I'll just start briefly with some summary comment. Always a pleasure to be with you all. And in anticipation of tomorrow's holiday, I would like to say a happy Veterans Day to all those who have served previously and continue to serve, including my father. So happy Veterans Day and thank you for your service. Just a couple of updates. From the conversation earlier, there are multiple jurisdictions who will be taking some action similar to what we are doing. And it has been referenced. The governor is having a press conference this afternoon at 5 o'clock. I do not know what he will be putting forward, but I know that the health officers from across the state have put in a request asking for there to be consideration for statewide guidance on closures, as well as some statewide action related to the increase in cases, similar to what a number of you all spoke about earlier this morning. When we look at the state numbers, the state totals are now, the test positivity is above 5% at 5.2. Cases are 19.8 per 100,000. 19 of the 24 jurisdictions in the state now have case rates greater than 10 per 100,000, including us at 17.3. And 7 jurisdictions actually have case rates greater than 20. Allegheny County actually has a case rate of 66 cases per 100,000 as of this morning. Our test positivity is at 4.5%. It has climbed from 2.7 earlier in the week. Our cases are 17.3 per 100,000, and our R0 is 1.48. We had previously seen some increases in our hospitalization rates and utilization. We actually had a meeting with the hospital leaders this morning, and as confirmed by our quantitative data as well as their qualitative report, hospital numbers are starting to increase, as well as the utilization of the emergency room for COVID-like illnesses. And what's also important anecdotally to report is that a number of the facilities actually mentioned that they're starting to see more young people, COVID patients come into the hospital as well. And so for those who think it's just strictly more severe for older people, that's just not completely accurate. We are continuing to work with our regional partners around all of these different issues. And just the last couple of things to highlight, I know that we talked about childcare facilities and testimonies from last week and schools. I did want to mention, we looked at our surveillance information and disease control information. We have completed, as of today, 412 investigations into childcare and school cases. Some of those were actually COVID cases, others were COVID-like illnesses, and we currently have 57 ongoing investigations in schools and childcare facilities and daycares related to COVID illnesses or COVID-like illnesses. We also have had reports in the last week of a number of concerns about outbreaks with sports activities. Over the weekend, we received word about a significant outbreak of cases involving ice hockey, youth ice hockey. Testing, we are continuing to work with our state colleagues around integrating rapid point of care testing into the county apparatus. We will continue to keep you posted on that. Since we last met, there also was a report, Pfizer released information suggesting that their vaccine candidate has 90% coverage and has had good results related to safety and side effects in their phase 3 trial. And as that moves forward, we will continue to keep you posted. And also, just the last thing I want to mention is, just as a reminder from the health perspective, public health guidance and economic diversity and revitalization are not exclusive items. We don't stand on the side and say, we put forth guidance to block economic growth and diversity. And we do work hand in hand, and we are hopeful that, yes, there will be more regional guidance, but at the end of the day, there will be state guidance and federal guidance, not only related to the public health platforms, but also around providing additional assistance to businesses and other entities who survive in this time. I will stop there and happy to answer any questions that you all may have. Thank you.
Thank you. Dr. Stoddard, please.
Yeah, I just have a few things I want to highlight. So in listening to the public hearing this morning on the executive order, Dr. Galesworth and I were exchanging some texts, and we did hear, and I think you all recognized this after it, that there were a few opportunities that we heard this morning in the public testimony, and some that we've gotten from you all through direct communications around some youth sports and bowling and a few other things where Dr. Gales and I agree that we can do some, take a look at these through the letter of approval process. And we'll, we weren't necessarily looking to do a wholesale cancellation of an activity that maybe it was a 28 person or a 30 person activity. Those kinds of activities, we'll look at the letter of approval process and we'll try and offer some accommodations there where we think it can be done safely. And just like we've done in other settings, what we'll just do is if we say, okay, maybe it's above the 25 threshold, are there some offsets that we can include in through the planning process that will allow us to buy down that additional risk of having a few more people there? And so we will take to heart some of the thoughts that you all had about some of these opportunities that will struggle to get to that 25 threshold. And so we've already given that guidance to some of the organizations. You all certainly can help us in getting that message out there more, and we will work with our letter of approval team on that as well. I did want to touch on Dr. Gales and I will be doing so as you know, we've been meeting with the non-public schools, and we've moved that to a bi-weekly discussion that we have with them. And actually what we're going to do during what would normally be our off week this week, we're actually going to do a meeting with our business community, Dr. Gales and I specifically answering their questions about where we're at and what we're seeing. I know that they've been meeting through the economic revitalization mission areas, and I know Councilmember Friedson, you've been actively involved in a lot of those conversations, as have many others. But Dr. Gales and I are making ourselves available to answer some of their questions and hear feedback from some of those various groups to make sure that we can, be providing them information, answering their questions, and just talking to them about where we're going. And so we're going to make that be a more regular thing as we have changes that are coming over the next several months. And we want to keep them ahead of it. We're going to try and make a more concerted effort to be meeting with them directly, as opposed to just having, other county representatives meeting with them. So everything across the board continues work. We are continuing work on a few opportunities we've had to increase our stockpile of supplies. We continue to make those available. At this point, we feel very good about our PPE supplies and things continuing into the fall. We're continuing to work with our nursing homes and assisted living facilities to make sure that they are purchasing what they need to purchase. But as we have said consistently, we will be a backstop for those organizations. We will not allow them to operate under the austere conditions that they had to operate in the spring because no one had PPE, including us. We want them to be part of the solution, and we'll backfill what they can't get. But obviously, we are not going to allow them to operate in the manner that everyone had to operate in the spring. And so we'll be in a much better place than we were then. We're over 13 million masks at this point. I think before we started this pandemic, we were in the 30 to 40,000 range. So that just tells you how stark the difference is between where we're at today than where we were at, 8 months ago, I guess, at this point. So I'll stop there and happy to entertain any questions that you all have.
Thank you, Councilmember Rice. And we're going to go to the 5-minute rule, please.
Hopefully mine will be very quick. So Dr. Gales, Dr. Stoddard, we've seen the Eastern Shore and the outbreaks that existed to where they had to shut down schools, that they had, I think, maybe a 20% of students returning. MCPS just released their reopening plan, and I think it ginned up a lot of expectations that MCPS is on track to open schools soon. In light of what you're seeing that's happening across the state, across the nation, when it comes to spiking cases, is it realistic to expect that we will not be going back to schools based on the numbers and the trend line until next year?
Well, I think where the numbers stand currently, without even injecting any, guidance from us, the state parameters that they put out for reopening were based upon positivity rates below 5 and case rates below 15. And so just by definition of the guidance that the state put out, we would not meet that criteria. And quite frankly, the state itself doesn't meet the criteria overall in general. I suspect, based upon the way our numbers are going, that it's a good chance that our test positivity will be over 5% by the end of the week, based upon the current trajectory. And again, that would put us above those parameters. Now, we did have a conversation with the Department of Health yesterday to ask if they were going, how, would they provide closure guidelines or implement that? And we were told that it will continue to be up to the local jurisdiction. But again, based upon the data that they put out, we would not meet that criteria.
Now, how does that? Oh, yeah. Sorry. Go ahead,
Can
Dr.
I just
Stoddard.
real quickly add, because I know it's been discussed at certain points that the school system is not listening to Dr. Gales or to myself, and I want to disavow that premise. Frankly, the chart that they are utilizing in their presentation is modeled after the chart that Dr. Gales developed as guidance for them, and so they're very much taking, and they have expertise that Dr. Gales and I do not have about the particular categories of schooling and what they're seeing from the results of their attempts to do remote education. And so obviously they've tweaked what was provided to them to make it make sense. But I think it's clear that if the trend line that we are currently on continues as it is, and we're hoping by the actions we took today that we're going to start to again flatten that curve. But if it were to continue in the upward trajectory that we fear it could, then I think I would be very surprised if you saw any really substantial in-school education. I do think, and I think that this is still true today, that they'll be considering particularly the special populations that they know are having really significant challenges in their education remotely, and we'll continue to look for opportunities to get them, a better experience, whether that's a combination of remote and in person or something like that. I still think they can and should be looking at those opportunities. But again, the scaling of how much you do is going to really depend on what our numbers do over the next, month or two.
Well, thank you for that. And I think that, again, it's indicative today, this council just a couple minutes ago passed additional funds for our education and equity hubs to deal with this particular situation, understanding that we may not get back to school anytime soon. Let me just ask, when it comes to our private independent parochial schools, now that we've achieved a very high risk, has there been any more guidance to them about whether or not they should remain with some of their hybrid in-person learning still, or should move towards all virtual?
Well, we had that conversation on Friday in our last session, and we basically, everything that I just mentioned in this call is what we talked about there, and pointed to those other jurisdictions who did make the decision to close as points of reference in terms of that guidance. And again, similar to Dr. Stoddard mentioned, certainly I think there is going to be an effort to try to maintain programs as best as possible for those who need it the most. But again, going back to the guidance that has been put out, we have blown past those measures that were set forward to open for hybrid learning opportunities.
I'll just close with saying this. It's been very clear through the data that even though children may not actually have symptoms of COVID as severe as their adult counterparts, they have been seen to be able to spread the disease. And so therefore, from that perspective, regardless of whether students tend to be more resilient in terms of the negative effects of COVID, they are not immune to the ability to be able to spread that disease to others in their family, especially during this time in which folks are coming together. So thank you very much, Dr. Gales, Dr. Stoddard, for your continued work. Thank you, Mr. President.
Thank you. Councilmember Reamer.
Thank you. Dr. Gales, you had previously shared with us the state's vaccination distribution plan. And I think, if I understand the process, the county is supposed to provide some. Can you just talk to us about the process for distribution? What needs to happen over the next month or two?
Sure. So the first step was the CDC asked each state to submit a statewide plan, and the state had contacted the local jurisdictions to do a needs assessment and capacity assessment from everything from staffing, refrigeration, all of those kinds of things. And we submitted that back to the state, who then submitted it to the CDC, who was not going to say, this is to grade the proposals, but to kind of, provide feedback and input. Now, in the meantime, because as you know, we're planning for a vaccine that we don't actually know about yet. We don't know what the specific candidate or candidates will be, particularly as it relates to how it will be administered, how it will be stored. Will it require multiple doses in order for true effectiveness? So what we're doing in the meantime is the priority distribution strategy has been put forth in terms of how groups are categorized. And so there's 4 priority groups. The first set of priority groups is dedicated to those with severe medical conditions, first line responders, healthcare workers. There's a subset of that. I think there's an age component to that too. And that spills over from 1A to 1B. And then the second phase, I believe, continues related to health conditions, frontline workers. I believe teachers are in that category. And then the third wave will be children. And then the fourth wave will be open to the general public, otherwise healthy folks. And so what we're doing in the meantime is, as we continue to find out more about the candidates, there's conversations related to, stockpiling of syringes and needles and things like that would be all of the ancillary support materials. We are continuing locally to look at places where we would need to store because all the different vaccine candidates have different temperatures and types of places where they need to be stored. So we're doing that assessment. Actually, we were talking about that earlier today. And we're also looking, in addition to the local strategies, to look at venues where we could distribute that. We are talking with our colleagues across the National Capital Region to do to think about some regional distribution sites as well to increase access points to make sure as many people as possible are covered.
Thank you.
If I may very quickly add to that, we have a lot of experience from the H1N1 process as well. I mean, it will be a bit different, but there are lessons learned that we can go back and look at our documentation for. The fortunate thing is, in the emergency preparedness world, and this is true of health emergencies or other things, we do a lot of after action planning, looking at what lessons we learned, and we record everything that we learned. And so we can go back and pull up the H1N1 experience where we had vaccination clinics across the state, across the country, to say, what lessons did we learn? And we've done that for, in preparation for what we may have to do here. And there are things that we can easily recall from H1N1 around, if you do a vaccination clinic in one area, people are going to come from all around the area to come to that site, just as they do our testing sites. And so coordinating them, as Dr. Gales has said, with our region, allow for one jurisdiction to not be disproportionately bearing the burden of the vaccination effort and taking up more doses from their local jurisdictional supply, and so there's a lot of coordination that has to go on. There are some things around supplies and equipment. There are some things around, it's not like we can take a librarian to give an injection in the same way that we can take a librarian to be helping at a testing site, right, where they can do part of the registration process. In the vaccination delivery, it really is heavily contingent upon medical personnel in a way that other testing locations or things like that have not been. And so, we learn lessons around H1N1 around using EMS providers to do vaccinations, around the kinds of contract nurses who can effectively do this kind of, vaccine delivery, as opposed to those who don't have as much experience giving injectable vaccines, things like that. And so there are a lot of lessons that we have learned from previous recent experiences that I think will help us and be in a better place. And Dr. Gale's teams are incorporating those into how we deliver this vaccine, or will deliver this vaccine.
Thank you. The Pfizer vaccine requires that super cold storage. Does the CDC provide that to us, or do we have to secure? Or if we can we secure our own facilities? Would that help? What's the implication of that requirement?
So a big part of it is, we're literally earlier today, the team is doing an assessment of freezer and storage space across the county, both in terms of volume and capacity, as well as the temperature settings that would be able to host it. We have been asked to not go out and purchase any additional equipment just yet until we have a little bit more specificity in terms of the vaccine candidate. But to your larger question, those types of things are being actively looked into as much as possible, again, without having a specific candidate in place.
So bottom line, people who are healthy adults, otherwise healthy adults, it's going to be a while. It's
It
not
is going to be a while, yes.
going to be a while. Don't plan on this anytime soon. Okay.
Thank you.
Wear
I did
your
hear on the-
mask. Wear your mask. That's how you know.
I did hear on the news this morning about the how cold it needs to be for the Pfizer product, that they're looking at dry ice as well and how that would work. I mean, there's all sorts of interesting topics. Councilmember Albernaz.
Thank you, Mr. President. I know we got a lot to get to. I'll stay under 5. Any updates on the waiver request with the states regarding childcare and the plans for the Plan B if we're not successful in the waiver request?
So no, there hasn't been any updated information from the state. However, there have been internal conversations that have been initiated, planning, an alternative plan. And so the hope is, I think that if we don't hear something within by the end of the week, you should suspect that we will have engaged in future conversations.
I appreciate that. And then this is more of a trying to be on the optimistic side, right? I think all of us are just
Love optimism.
clamoring for something positive in the Pfizer news earlier this week, which I know still needs to be verified, and we still don't have a lot of details. But there's an air of depression and desperation that a lot of families are feeling right now with students in our school system. You can feel it. All of us are feeling it, especially those of us that have kids. And so we're all just we're doing the right thing and keeping everyone safe. But the long-term mental health impact of students who are being impacted by this is going to be written about for years. And there is a line, and none of us know where that line is in terms of crossing it, in terms of the other impacts of the virus. So from an optimistic standpoint, let's say Pfizer's vaccine does come through. Let's say it passes, FDA approval and all the other approvals that it needs. And we institute the plan, an aggressive plan to administer the vaccine here in Maryland. Let's say it hits the streets and is approved, best case scenario before the end of the year and is out for mass use at the beginning of next year. Just from a medical and efficacy standpoint, Dr. Gales, what percentage of the population, generally speaking, would need to have had access to the vaccine for you to feel comfortable in providing a recommendation that students can get back to school, we can move from phase 2 to phase 1 or phase 3 to phase 2? Like, what's the window? Because there are a lot of families that are just very worried that their students aren't going to go back at all the entire year. And that's a very understandable concern, and frankly, a real one if the numbers don't go down. So, what would that threshold be if the vaccine's available before we could start to turn back and start opening again?
Well, that's an excellent question that I don't have a definitive answer to. But what I would say is this, is that, vaccines are coming. We're excited about it, and hopefully they will be here sooner than later. And I think when we do that, certainly we would love to see as great of a population as we can get covered. Particularly with the way the prioritization has been set up, is those who are most vulnerable, who we are most concerned about having an adverse or severe complicated course with COVID, would get the vaccine first. And so if we can get those folks protected, then that gives a little bit more a sense of confidence in terms of being able to protect them and keep them safe. Now, that said, us getting to a point where we can get kids back into school in some capacity and have those activities return isn't entirely dependent upon the vaccine. It also is significantly dependent upon our ability to adhere to the evidence-based guidance we have in place already in terms of face coverings, minimizing contact with folks, in some ways, probably minimizing our interactions around holidays upcoming. Because then, if we can tighten things up in that way, we can get the numbers going back down. That, again, isn't reliant upon or doesn't require us to wait until the vaccine comes out. So I'm hopeful and optimistic that with restrictions such as those that we put in, potentially those that may be implemented at a state level or regional level, will allow that curve to turn the curve back around to get those numbers down so that we can move forward with some of those recommendations.
Final
If I-
point
if-
in my
if I-
45
so
seconds. Oh, go ahead, Dr. Stoddard.
I was going to just add to this point. The other thing that we also know that is coming that will help us a lot in having some options is rapid testing. And so we've been talking about that, and that is probably just as around the corner as some of the vaccines are. And so hopefully early next year, we'll be able to have a combination of some vaccine and some rapid testing that may be able to give us some options that we do not currently have today in terms of opening things up, particularly in our school settings. And so in the interest of being hopeful, as you've suggested, there are some other things, other tools that are coming down the pike that will give us some additional options that potentially could allow us to open things up, particularly certain settings or key settings that we've defined as community priorities a little sooner.
Final point in my 45 seconds that are left. We're all hoping that the other corresponding jurisdictions follow our lead with what we did earlier today. But if they don't, then I think that, obviously we'll have to revisit this, strategy as a whole. But I think we should also potentially recommend that people that do go to those weddings or those other events or programs that are restricted here, that they should quarantine when they come back. Because, if we're not able to restrict what other jurisdictions are doing, New York is doing this with other states in partnership with New Jersey and Connecticut. I think we may have to explore something like that here if other parts of our region don't follow our lead. Thank you.
Thank you. Council Vice President Hucker.
Thank you, Mr. President. Just shifting a little bit to a related topic, very much on my mind is the challenge to the ACA before the Supreme Court today. Obviously, if they strike it down, it's disastrous for the whole country, but thousands of people in Maryland would lose their coverage, and the rest of us, we're lucky enough to have coverage, probably would have higher hospital costs and higher premiums. It was reported yesterday the state could lose $4 billion in federal funding. Germane to this, 148,000 Marylanders now have a new pre-existing condition due to COVID. So I don't expect you to have a contingency plan today, but I'm sure it's on your mind. I would just suggest, Mr. President and Mr. Chairman, we have a full council briefing sometime, in the next month or so. And I would ask, maybe we could have our central staff look into what COG and MACO and NACO and NCSL are doing on this, so we can be coordinated with our regional partners and the state as far as amicus briefs and other contingency planning. And it would be smart, I think, to make sure the Office of County Attorney and OIR are involved as well. So I'm just flagging that. I don't know if you have anything to respond, but
Sure, go ahead.
I can tell you that we've been looking at it endlessly because it directly impacts our, services for the uninsured program. So we've been looking at it for the last 6 months, recognizing that could be struck down and how we might have to tinker that program, because a lot of our energy and efforts there has been based upon getting people into programs that they're eligible for, both from a Medicaid perspective as well as a qualified health plan perspective. And so we haven't necessarily looked at it strictly related to COVID, but we have been discussing it related to the Montgomery Cares programs and all those other services.
okay.
Yeah, I was just going to add that I think this is going to take, it's going to take a massive undertaking to do the planning. I see Dr. Propel on that call. I don't know if he has any comments, but certainly I will say, from having monitored the traffic this morning, some of the arguments before the court today are a little bit more hopeful than I think I thought that they would be, frankly. Some of the justices have recognized the severability of the mandate potentially, which, would make it make things a bit better. And so, not to say that we should operate under a system of optimism. We have to, hope for the best, prepare for the worst. And I think that's exactly what we've been doing.
And Mr. President, we do have a committee session on the ACA before the HHS committee. And we'll make sure all of our colleagues get an invitation to that session to discuss this.
Thank you. And I was going to point out to Vice President Hucker, in 20 some days, the person you might be checking with to schedule this is a fellow by the name of Hucker. So anyhow, just mentioning. Councilmember Navarro, please.
Yes. Well, here we are. I think we've been sort of discussing that we were going to have to get to this point. So just two brief questions. One, could you talk a little bit about what today was announced? And I know I received a push notification from the state of Maryland regarding contact tracing. And there's been a press release regarding that. And so obviously I saw it and I needed to double, triple check, because you never know when you receive these kinds of requests, but it would be good for our constituents and everybody to know what that is all about. And then secondly, I guess connected to that and to the conversation that we're having and the executive order we approved, just how are we shifting in terms of communication strategy? Again, I think that we can all agree that we are entering a different stage now, and perhaps we just kind of need to remind everyone as to why it is that we're entering into this new phase, and how are we then updating or adapting in terms of our communication strategy.
Sure. Well, the first question that you referenced, and I actually had it on my notes and didn't go, it was item number 3, and I skipped over it, it is the state contact tracing app that DC launched. It's similar to what DC launched a couple of weeks ago, and I know a number of other states. And the goal is to basically use that information to ping the system if you've come into contact with someone recently who tests positive. And so it's a lot more complicated than that, more details, but ultimately it is the contact tracing app where you can use your phone to ping and say, oh, I got a notification, Earl tested positive, and I happened to be next to Earl yesterday, and the phone information will light up and ping to say, based upon algorithms, you need to get tested and follow up with your local health department for an interview or follow-up. And what we can do is, I know that they've sent a series of press-related information out. We can share that with you all as well. I think it was sent to the PIO maybe yesterday, late afternoon. And I would imagine that given the timing, the governor will likely mention it this afternoon in his press conference. And as related to the communication strategy, I can just, Dr. Stoddard can also weigh in. I know that the PIO has been working with, I think we're set to meet with Councilmember Glass to follow up from the meeting on Thursday related to some of the comments that he had mentioned in terms of creating a daily message of sorts to remind people, as opposed to, the hearsay that numbers going up, but figuring out a succinct way that whether it's a tweet on the county site or just a blurb every day to kind of give people a point of reference in terms of how we're doing.
I would just
That
add
would be wonderful. Go ahead.
Yeah, I was just going to, sorry, I didn't mean to interrupt, council member. I was just going to add that we're really transitioning, and this is going to sound super negative, but away from the reopening mantra, because I think we recognize that reopening is essentially paused for right now, is for better or for worse. Well, definitely for the worse, I should, to be clear. But that we've got to transition sort of our messaging back into a greater focus on the interventions that we all can make. The Mask Up campaign, we've had a ton of multilingual posters put together. We're going to make sure that we're deploying those around the county. We're working on some additional signage for our businesses, particularly around like the contact tracing requirement that was added today for our restaurants. We're going to add that. We're going to add that to add some signage for that. And so we are definitely going to increase the communications that you see, particularly focusing in on communities that we know have been greatly adversely affected, but also shifting the message more towards not a little bit away from reopening and more towards the personal interventions that we can all make to be safer. And so we're having conversations this week about how exactly to transition and how to build it up. And so if you have feedback, certainly do share it with us. And I mean, you have shared it with us, to be clear, but if there are additional feedback on how we can proceed with the communications front, we're absolutely interested in hearing it.
I appreciate that. I think that Councilmember Glass's expertise and recommendation is on point to the extent that we can, have that kind of very targeted messaging, maybe on a daily basis. It's very helpful. Because I can tell you from experience, even as I deal with my young adult daughters, that shifting the message and making sure that everybody understands what we're entering now goes to that issue of the fatigue piece, where people kind of felt like, hey, we've done all the great things. Now we can kind of go, relax a little bit. And it's kind of like, sorry, but no, because now we're entering this new phase. Making that psychological shift, I think it's going to be really important but at the same time, very difficult. So to the extent that our PIOs, who are the experts, can begin to craft and tailor that message, we'll be happy to amplify that as much as possible. Thank you.
Thank you.
While we were not necessarily optimistic about the governor's message from last, he at least started talking in terms that were more consistent with there being a real change in our condition, which obviously one of the biggest challenges that we face in the communication side is when there's inconsistency between the message the state is putting out and the message the county is putting out. And so at least we're starting to seeing that transition in his assessment of the situation. And so hopefully with today's press conference, as Dr. Gale said, we don't know exactly what's going to be said. We've gotten some rumors, and the rumors are actually are more like the governor from April. But we're hopeful that at least, if nothing else today, he's continues to be aggressive about the language, so that helps us in our messaging as well.
Absolutely. Thank you.
Thank you, Councilman Vice President Hucker. Did you have another item?
Just quickly, and thank you for your text, Dr. Stoddard. I mentioned the big box stores earlier. It was just confirmed, I guess I had bad information earlier, that you're allowed to issue civil citations to any retail establishment or any restaurant, right? Have we issued any for any of the large grocers or big box stores?
I have to go and look. I don't believe so, but I think it's really important to understand that I think what we're suffering from is the big box stores and grocers were largely viewed as essential businesses. And I know
early on,
you talked a lot about what essential means and how, if you're a business owner, your business is essential to you. And I think that definitely is true. But I think the legacy of that experience is what's framing their action or inaction in this case. And so while you were making those comments earlier today, Dr. Gales and Ms. Kinch and I were exchanging texts and discussing how we get out messaging and or potentially more strong, right, maybe a health order or something along those lines to make the more clear point that they are not exempt from the rules in the way that they felt like they were earlier on in April as an essential business. And so I can get you I don't know if Dr. Gales knows off the top of it. I don't think we've issued a citation, but I don't want to say that we haven't. And we can find out, and we're going to push that issue this week.
We had some citations early on related to safety precautions for their employees and things like that, but none, as best as I can recall, in the recent history.
I just if I can just follow up briefly, I think there's the perception and the reality. Perception, I've heard from a lot of smaller restaurants, etc., who are willing to do their part. They're under great pressure. They're having a hard time paying their rent, etc. We're imposing more restrictions on them today, and they feel, right or wrong, that they don't see those kind of restrictions on large retail stores, which are all, of course, national chains and very profitable. And then two, you're right. I think they are essential. Maybe not every trip to Home Depot is for a broken water heater or something. There's a lot of just shopping too, but they are essential. They're going to stay open. That to me doesn't mean they shouldn't be following best practices, right? Including wiping down carts and masking and distancing and the rest. And I don't see that very much at all. And I do see it at a couple of responsible grocers that I mentioned earlier. So I think your education campaign to them, I think would go over well, both from a public health point of view and from a parity and fairness point of view.
We concur.
Okay. Thank you.